the end of this week, you complete 6 months of pregnancy. And next week, you are already in the 7th month and 3rd trimester of pregnancy. Congratulations to you and your baby too. Did you know that if he's born from now on, the chance of survival is between 70 and 80%? But that's not all I have to tell you, is it? If you want to know everything about the changes, what is happening to you, belly size, baby video, news about your baby, feeding tips, and a tip for this week, stay with me and I will tell you. Hello, I'm Monica Romero. I'm very happy to have you here with me, especially this week that I came to tell you that the chance of your baby surviving a premature birth, which is not what we want, but is already between 70 and 80% and rising and increasing. It's a lot of reason to celebrate, isn't it? And you know what else we can celebrate? This beautiful, beautiful version of your belly. Look how much she has grown since the first day of her pregnancy. Your uterus can already be felt about 7 centimeters above your navel, and your uterine height is around 26 centimeters. It gives you a belly of respect, right? A much more rounded and beautiful version of you, huh? To think that we often don't like this version of ourselves very much. One more thing that the media sells us, that we love being pregnant, but not everyone feels good, either because of discomfort or because they look in the mirror and don't like that outfit. They don't wear anything well, and in other women feel a maximum full and beautiful. But we have some discomforts, right? Which ends up showing us that it's not that easy. Tell me how you're feeling, and remember that the biggest focus is this little baby who will soon be on your lap and sucking the colostrum that is producing. Accelerated, remembering the colostrum. It is in small quantities, so generally 99% of women will not notice it leaving the breast during pregnancy. Because what happens is the following. This here is the gastric capacity of your baby in the first month of life. When he's born, look how much he can fit in his stomach, that's all. 3 days later, have the descent of milk pojadura. Look how much bigger your stomach is. And then he'll start sucking more. And our stomach has the ability to dilate, to grow, and a month to live. He already has a much bigger stomach. It happens. Because in the beginning, when he was still swallowing amniotic fluid, he still can't swallow a large amount, but it's enough to start making his organs work. But calm your tail better when you're talking about your baby. Since I'm talking about you, your total blood volume has already increased over 25%. And we notice that it increases because the finger gets fatter. It doesn't fit a ring because the ankle gets bigger, because the foot gets swollen. Oh, why deposit where you shouldn't, right? That could happen. And to reduce the swelling, what do? It increases water intake, and whenever we are sitting or lying down, it leaves a support under our feet so that they are higher and activates circulation. Oh, that's a photo. Okay, Monica. Except now I'm peeing all the time again. I can't keep drinking all that water. I will tell you that temporary urinary incontinence is a very common condition in pregnant women. And that is why it is temporary, because it is in pregnancy. After the pregnancy returns to normal, we sneeze, pee. It happened to you. Tell me, it happened several times. We cough, we pee, we're a little tight. We don't even have time to get to the bathroom. We pee, we go to sleep. We have to wake up at dawn to pee. Things happen. The only thing you need to investigate, and is part of the exams now in the 2nd trimester, is if you have any urinary tract infections. If not, it's perfectly normal. We not only have incontinence, but this desire to pee all the time. Your uterus is almost a little bigger than a soccer ball. This means that he is pressing all the organs, and now they are all the same. He is pressing the lung. Sometimes it gets difficult. Pull in a lot of air. It seems that the lung does not expand as much and will improve. Do you know when the baby fits in, the time the baby gives that little fit, then the lung relieves? You will realize this later when it happens. You tell me in the comments, Monica, it happened that I was breathing better when I drank curry. Before that, no. We get that lung that can't fill that stomach, that has slow digestion, that is disturbed. We get a bit stuffed, but still hungry as a lion. Our bowel is also pressed, and our little bladder, little of it, is very impressed. And that's why this all happens, is part of the process. But don't decrease the amount of fluids, okay? They're very important. To hydrate your skin, to hydrate your body, and to hydrate your baby. I've been talking often these last few weeks about training contractions, which are Bracton Hicks. What happens in these contractions? Imagine that this here is your uterus and this is your cervix. Inside this cervix that has a mucus plug, his cervix has to be elongated and closed at this time of pregnancy during the contraction. Oh, you can see that his cervix will not change. It is there the same way. And what about these contractions? They tighten our bellies, but they are not rhythmic. They do not increase the number of times it happens by decreasing its interval, nor do they increase the intensity. They don't get stronger or longer lasting. But if by chance you notice that your contractions are a little longer lasting, they are starting to take smaller intervals. For example, you have one contraction for 10 minutes, then you have another. It is important that you call your doctor or go to an emergency room with obstetric care or a maternity hospital because of the risk of premature birth. When we start having real contractions, take a look at your right. What's going to happen? She comes from here, to expel the baby. The Kirks begins to decrease, and as it decreases, you will lose the mucus plug, and as you will lose the mucus plug, you will begin to dilate for your little born baby. Because of this, it is very important that you pay attention to bleeding, pain, swelling. Sudden can also mean preeclampsia, very high blood pressure. So all this needs to be investigated. Bleeding during pregnancy usually doesn't mean anything, but now to you. He has a 1/11 risk of being born prematurely. And we won't just take the risk and wait at home to see. You have to go to a hospital, investigate. In pregnancy, any bleeding needs to be investigated because most of the time we manage or discover that everything is fine and you will be fine too. Or if you need some help, the sooner you find out, the better the treatment and the outcome you'll get. Is it agreed then? The contraction is hurting, it is reflecting in the back, it is bleeding some type, there was sudden swelling, it is feeling a lot of pain, it is looking for obstetric care and only an addendum, the Braxton Hicks, which are the training ones. They are usually more felt in twin pregnancies and also after some physical activity or some physical effort, such as climbing stairs, sexual intercourse, a very long walk. Of course, you do usually after these big movements. We have 11 harder, more painless bellies, okay? And a tip for you that is important, and if by chance you haven't thought about it, you will think, be careful when getting up when you are lying down. Before you stand up again, sit down a little bit for 1 to 2 minutes. Let your body adapt to this new posture. The same goes when we are sitting half lying down. Lift the posture, let it hold, wait 1 to 2 minutes, and then you get up. What happens is that when we get up very quickly, because of our blood pressure, because of our body, it is all focused on this baby. And because it has changed the center of balance, that is, our spine, which was previously retained, is now more bent forward. We may have dizziness or a drop in pressure, and this can cause, for example, fainting or falls. And we don't want that to happen to you, do we? But it is also common at that time that you start to have a little more difficulty lifting, exactly because of this point of balance. It gets harder, right? The weight is different. There is no shame for any pregnant woman on this planet to ask for help to get up. I ask for help. Ask your partner to stand up in front of you and help you. Ask your eldest son there. Ask your mother, father, friend. It's not a shame for anyone, and it's not cool either, okay? It is a beautiful of a help, and if you are feeling a lot of pain in the back, if you are feeling a lot of pain in the lower back, in the leg, Cramp has some exercises for pregnant women that can help you, and you can do them at home. But if you have a help, it will be even better. The first of these is the squat. You're going to spread your legs and stretch your arms and bring your butt back slowly, okay? The feet need to be fully supported on the ground for this movement. This will help relieve your back a little bit, and which relieves too much this famous cat position in yoga, and will push your belly forward and your back back. Stay a little with your stomach forward and your back behind. These stretches help a lot, but if you have professional help, it will definitely bring you much more results. And my favorite time, it's time to talk about your baby. Oh, how cute! Your baby is already 23 centimeters from head to butt. If we consider the legs, it will be more or less 31 to 34 centimeters and weighing around 900 grams and can gain at least about 100 grams during this week. Will you get to 1 kilo? Huh? Do you already have a kilo? If you already know you had an ultrasound, tell me that I want to know, because I want to know everything about everyone's pregnancy, that I'm really curious. Her skin, which at the beginning of the pregnancy was totally transparent, you could see all the veins, is now rosier. She started to turn pink a few weeks ago, but now she's even more pink. But she's still fine. Cute? Huh? Cute, huh? There is still an excess of skin because it is already prepared to receive all the fat that your baby is already accumulating for the time of delivery. And it is a very important fat that will also help you in the first days of life. Once a baby is born, it is common for him to lose up to 10% of his weight in the first few days. In fact, most maternity hospitals and hospitals only discharge mother and baby when they gain weight again. This is because before he was receiving food automatically through the umbilical cord. From the moment he leaves this environment, he needs to breastfeed, he will learn to breastfeed. So there are several processes. And the little baby in Cobrizinho, despite the colostrum being super nutritious, can, yes, if I lose a little weight, but soon after he recovers. And how do you get our arm back? Let me tell you, see? His little eyes have already begun to open. His eyelids have already opened. And your retinas are now also already formed, although the baby's vision, even she will develop better outside the womb, as you can see in this image. As it is the vision of a newborn, he hardly sees any color, only very blurry shades of gray. And then over time, this vision will improve, it will color, and he will also learn to focus. But even so, it is already possible to detect brain waves in the baby's visual area. Do you believe it? And another thing, lots of brain waves in the auditory area. He's listening to everything that's going on and he's recording it. And that's why he'll recognize your voice. He will recognize the voice of dad, mom, grandma, grandpa, everyone who lives with you. And that's why sometimes the newborn is sleeping. Ring the bell. He doesn't even wake up. He is already used to the noise of the bell. There is no reason to be scared more by it. That is noises that are within his routine. The baby ends up getting familiar too and will scare less when he has this extrauterine life. I told you that the surfactant liquid is the one necessary to let the pulmonary alveoli expand and return when it's time to exchange oxygen, right? To be able to oxygenate our blood. It began production this week A. The reduction is still better, but calm down that this process will still take a little longer, okay? But already know that your baby's lungs are not yet working on breathing because he is inside the amniotic fluid. He will only be able to do this training after childbirth. And even though he can't do that workout, you know what he's doing? Movements. Respiratory movements he is already starting to do, but he still can't breathe. And the last information is also important for you to know that now your baby has less space. In other words, fetal movements are felt in greater intensity and increase until the end of pregnancy. It is important that you notice, because this is the best sign of the baby's vitality. It is important that you notice if by chance the baby is not moving for a long time, because the baby ends up staying awake a few minutes, and he sleeps for 1 hour, but he wakes up, and when he wakes up, he moves. And what will you do if you find that your baby has been standing still for a long time? Are you going to eat some candy, a chocolate? I think the best tip, see? Always have a little chocolate at home. You will eat a little chocolate. You will lie down, settle either on the sofa or in your bed, there with your belly up, and you will notice for 15 to 20 minutes if there will be any movement of the baby. It can reach up to half an hour, okay? If you notice that he is moving. If you think he hasn't moved during this period, it's important that you talk to your doctor or even go to a hospital with obstetric care or a maternity hospital to perform an ultrasound and make sure everything is okay. And between you and me, you'll probably wake up till dawn with these movements. See? These kicks and punches and elbows become more and more evident. And in a little while, you can already see them moving their own belly. Several waves. And in my nutrition tip this week, did you know that iron supplements can cause constipation? which is something we are already suffering from? My tip last week was exactly to get rid of him. So that you don't need to supplement iron due to anemia, due to not eating adequate foods. Sometimes we need it anyway, okay? There are some conditions that are really necessary, but if you can help with food, look at how many foods are rich in iron and can help you, such as red meats, cereals, vegetables that have those very dark leaves, you know? Dark green also has iron, check it out, broccoli. In addition to everything, it has vitamin D, which helps in absorption. Iron, what a perfect thing. Egg, I already said egg, so let's talk again. Egg has a lot of iron-rich food that will help you. And of course, you have to remember your water too, huh? You have to drink at least 2 liters of water per day. In breastfeeding, this amount will rise significantly. If you think 2L, for you to be calm, try to increase a little to hydrate more. It will be better to give less stretch marks to hydrate you more. It improves even the stool. They get better too. They get less dry. So water's only good and soda doesn't count, huh, lady? No, no, no. And if you like juices, don't forget that many have sugar, even if it's not the artificial sugar we're putting in. Fruit has sugar. So if the problem is weight gain, it's best to control your juices a little too. And my tip of the week is being inspired by my Instagram directs. Don't follow me yet. Oh, follow Almanac Dos Pies. Enjoy it and let me like it here in this video that the image is already complete for you. What happens? There are many pregnant women who come to tell me, Monica, I want to eat dirt. Monica, I want to eat brick. Monica, I want to drink gasoline. I got this, Monica. I want to eat, wow, some things. Ice cream with soy sauce. I want to eat rice with chocolate. Some very, very crazy things. So what am I going to tell you? There is not much absolute and full certainty if this is true, but it is believed that these desires are linked. Lack of some nutrient in your body, and generally those who want to eat brick and clay are lack of iron, eat beans, much tastier. And then I have to come to ask you, when you have a crazy desire, you write it down because it's very funny to tell these stories afterwards. But don't succumb to these desires. You won't eat a brick from me around. Please, okay, do this one. Start here with me. No crazy desires, okay? Do you want to eat grandma's pasta mixed with caramel syrup? I doubt it. Look good, but you might like it, okay? Oh, I want to eat is salt and water biscuits with strawberry yogurt. It may not be the best combination, but there's nothing there that's going to hurt you. So when it's a couple of combinations, it's kind of crazy. But they won't hurt you. Okay, it kills that desire, but if within these messes there are alcoholic beverages, things that are not food or foods that can pose a risk to you, Nananina doesn't have to control itself. And if you've had any really crazy cravings, tell me, because I'm a frustrated pregnant ex. I had no desire. Can you believe it? I had desires, but will that I have to this day? For example, now I feel like eating chocolate. I didn't feel like that, but nothing that, look, if I don't eat, my son will be born with a face. No, I didn't have these more serious desires. No, but tell me if you did, and if you had any crazy people, you tell me too. But oh, none of this can be done, okay? I really hope you enjoyed this video. If you liked it, don't forget to leave a like for me, and I'll see you in the next video.